What are the pros and cons of taking prednisone? This is really important because prednisone can do lots of things, but it can also do lots of harmful things. How do you know what to do? Well, I'm Dr. Megan, your prednisone pharmacist, and I personally had to take prednisone. And throughout my journey taking prednisone, it was constantly a pros and cons weighing of the risks and the benefits for me. Those risks and benefits changed over time. Those pros and cons were not stable because prednisone, while it's a miracle, can cause miserable side effects that can accumulate over time. So let me tell you all about the pros and then we'll talk about the cons. Good news before the bad news. So the pros. Prednisone is used for many conditions. Basically, any doctor can prescribe it for something in their specialty, whether it's a heart doctor, a lung doctor, a skin doctor, an eye doctor. They can all prescribe it, even dentists and podiatrists. So what would they prescribe it for? They can prescribe it for anything to do with inflammation. Basically, any disease that ends in itis, arthritis, sarcoidosis, I guess that's ends in osis, but polymyalgia rheumatica, all of these different things that are inflammation, okay? Any type of inflammation, prednisone can help with. Whether it's your throat closing off or your eyes turning red, prednisone can help to slow down the redness, the swelling, the constant inflammation that might be causing pain or joint discomfort or the inability to open a jar. That's the first type, is inflammation. The second type, the second pro, is it can help with autoimmune conditions. So any situations where the immune system is attacking itself in some way. So that's my condition. I was taking prednisone for ITP, immune thrombocytopenia. My immune system was attacking my own cells called platelets, leading me to have no ability to clot. I could have bled to death without prednisone. I'm so grateful that it exists. It truly is a miracle and saved my life. So those are the two main things, are inflammation and immune system issues, autoimmune, arthritis, asthma, and anything else from inflammation to eyeball inflammation. Those are the pros. It is the last resort. In one hospital, they have a saying, never let anyone die without a steroid, like prednisone. Never just have someone have a confusing condition that you don't try to give prednisone and see if it helps. Maybe that's what's causing the problems. Because it can often help in so many amazing ways. When prednisone was invented in the 1950s, it changed the world. It truly made people like me have a different possibility for their health in the future. People who had rheumatoid arthritis and had no choice but to shrivel up in pain and not ever function again were suddenly able to use their hands, to move, to live without horrible pain. It is amazing. The pros are truly amazing. And for you, I want you to know for certain what the pros are for you because, like I said, any doctor can prescribe it for pretty much anything. But is there evidence that it helps for you? Far too often, but rarely, prednisone is prescribed when there is no benefit, when there are no pros. For example, lower back pain, no benefit that prednisone can help. Bronchitis, just plain old coughing without asthma or other things causing it, no benefit that it helps. And other conditions like rashes, maybe it's going to help, maybe it's not. So why does that matter? Because of the cons. There are so many horrible cons when it comes to prednisone. The pros, like I said, are miraculous. So the cons are equally astonishing. Taking prednisone is making a deal with the devil. So what is this deal that you're making? What is this deal? Well, when it comes to side effects, prednisone has more than any other drug. At least 150 side effects can be attributed to prednisone. At least The crazy part is nobody actually knows how many side effects there are because, like I said, prednisone is a super old drug, and the drug company didn't have to test to find out how many side effects there are. So, of those that we know about, there are at least 150. And they're not just simple things, though some of them are. Some of them are horrible. For example, the worst one I know of is called avascular necrosis. It's where the top of your long bone, your femur, that allows you to walk in your hip joint, the very tip top of it starts to die. The bone death. This is permanent. There's no solution to this problem aside from a total hip replacement. And this can happen to people in their 30s or even younger. Avascular necrosis is this horrible side effect that is permanent and life-changing. Others include osteoporosis, bone loss, leading to broken bones, loss of height from the compression of the spines upon each other, and potential hip replacements for those as well, broken bones. Then there's blood sugar changes. So prednisone is a glucocorticoid, changing the way your body metabolizes glucose. This has so many downstream effects, not just that you have high blood sugar. That can lead to diabetes. It can also lead to weight gain and complications of diabetes like heart disease, high blood pressure, kidney problems, eye problems, and on from the high blood sugar leading to diabetes. Then there are other eye side effects like cataracts and glaucoma that cause permanent damage to the eyes. Other cons include mood changes such as depression or panic attacks, insomnia, mania, delirium, and on and on. There are so many things that can happen. Prednisone even got its own diagnosis code called steroid-induced psychosis that leads to people being hospitalized for how it's affecting their brains. Then there's what it's doing to your adrenal system. So prednisone is replacing your body's hormone called cortisol that is created by your hypothalamic pituitary adrenal axis, and it helps you deal with stress. And if you go cold turkey off of prednisone, you won't be able to cope with stress. Your body can go into multi-system organ failure and you can die. It's called adrenal failure. And adrenal crisis, adrenal insufficiency can all be complications of what prednisone is doing. And so you have to go through a taper, slowly going at a lower dose over time, or you can deal with withdrawal symptoms as well. Like I mentioned, prednisone is used for immune system issues. So it's turning down the immune system. That means it can increase your risk for infections like pneumonia. So prednisone is truly a miracle, but it's also one of the most harmful and miserable drugs on the market. So you really have to know in your situation, do those benefits outweigh the risks for you? You've got to know precisely what the benefits are so that you can see if some of those risks that I just shared with you are worth it. Not everyone gets them. Most people get the weight gain and the moon face, but not everybody gets all of those other horrible things I mentioned. In fact, avascular necrosis, the first one I mentioned, is incredibly rare, but it happens. And so do you want to put yourself at that risk? I can't tell you how many people have told me, I wish I'd never taken it. That thing I was dealing with, the pro, just wasn't enough to outweigh the risk, right? The benefit and the risk have to be in balance for you and your condition. And I can't tell you what that is because there's so many conditions. So you've got to know between you and your doctor, is this amazing miracle drug worth it for you? And if you're wondering if there's anything you can do to bring the benefits more in your favor by minimizing the risks, well, then I've got the thing just for you. It's called my Prednisone Checklist. It goes through a checklist of things you can do to minimize your risks so that you can feel as well as possible while taking prednisone. You just go through each step and do the things I outlined for you to counteract as many side effects as possible to either minimize or prevent them from happening to you. So just click the link below to download the Prednisone Checklist now. and you'll know exactly my best tips for how to proceed with your prednisone therapy to make sure that the pros and the cons stay in the right balance for you. Signing off as Dr. Megan, your prednisone pharmacist.